We're in lockdown level 3, and one of the most populous provinces is in its third wave, and the vaccination queues are thinning out in Gauteng and in the Western Cape. But is this vaccine fatigue? Is it COVID fatigue, or is it something else entirely? Well, to answer that question, we're joined by Dr. Jody Boffa to discuss this with us. She's a research fellow with Stellenbosch University and the Centre for Rural Health at KZN. She joins us now via Skype. Good morning to you, Dr. Boffa. Let's start off with the drop in people getting vaccinated. Is it fatigue or is it hesitancy? What exactly is going on there?
I mean, I believe it's hesitancy. What you're going to see and is what is probably going to be required at this point for some of those people who are hesitant is to see those numbers go up and people unfortunately be the casualties of COVID-19. It happened in Gauteng when their numbers drove up, the queues for vaccination shot up as well. But it is, I mean, the people who wanted to be vaccinated right away have been there, and the rest are just going to need that little bit more convincing.
Yeah, well, let's talk about that convincing. What is it that you think government really should be doing to improve that discussion and that dissemination of information?
It's tricky, right? I mean, I work with people who are, well-educated critical thinkers who are still vaccine hesitant. So the answer to that isn't straightforward. I do think there has to be open dialogue, especially in rural spaces, especially in places where there are a lot of people living in condensed housing. Open dialogue about what are the fears and what are the hesitancies. And not speaking over that, but responding appropriately, right? And there have been a lot of attempts to do that. But ultimately, what's going to drive the next phase of vaccine is unfortunately people falling ill. I do stress to anyone listening to this, if you haven't been vaccinated, find out those around you who has been vaccinated. Find out if they've had any negative experiences, and then reflect on how many people you know who've had COVID. How have they fared? Do you know people who have been hospitalized? And I guarantee you will see that when you weigh one against the other, the answer is clear. Vaccination is the safest way to go.
Yeah, it's been interesting tracking just the pattern of how the virus has moved through the first wave, the second, and now the third wave. KZN now reaching, some very scary numbers, but it's done so after Gauteng in the Western Cape. Is there a reason why we're seeing KZN's numbers peaking or getting higher after the Western Cape and Gauteng?
It's difficult to say exactly why that is. Part of that likely due to the level 4 lockdown we went into and people being discouraged from traveling to Gauteng, so it wasn't spreading outside of there as quickly. I think it's just a matter of when the exposure came and how quickly it spread. So the timing has to do with the exposure, and I think we've been seeing it much less than it would have been in the second wave if we had seen this variant, because so many people are vaccinated. So vaccination is working for those that have it. And we're seeing, all over the place that younger people are winding up being more severely ill than proportionately. And that's because the older generations, a greater proportion have been vaccinated now. So it's just going to happen.
Yeah, a lot of experts essentially saying that it's too early to be talking about lifting some of those lockdown restrictions. But do you think that this lockdown is working? And perhaps you can talk about a few bits that you think really need reviewing, considering the numbers as they come out in KZN.
Well, listen, it is working. We would have seen things a lot worse off. Given how quickly things spread with this variant and given the amount of vaccination that is yet to be done. What can be done better? It's just that constant reminder, right? That constant reminder that we're not out of the woods. We see it all the time where people, they feel slightly sick, they think, oh, it's nothing, but just to be clear, we are in the thick of it. We are in the thick of it, especially in KZN. And anytime anybody suspects that this might be symptoms, stay home, isolate yourself from others, see what happens to those symptoms the next day. If they're getting worse, think about getting tested, and just don't go anywhere you don't need to go. Don't expose anyone that you don't need to expose.
Yeah, I'm gonna, before I let you go, I think we should take just one last shot at it, and we're going to keep doing it, I suppose. Convince the undecided viewer right now who is going back and forth about whether or not they should be getting vaccinated. What do you say to them?
Well, for me, there's three things. Protect yourself, protect those around you, because you might be one of those lucky ones that doesn't show symptoms, but you could still spread it to people who are very vulnerable. And thirdly, hey, for the people that have a lot of money, if you want to travel this world again, you're going to need to be vaccinated. So there are your three top reasons that I can think of.
No, that's pretty convincing for me. Thank you so much for speaking to us. Dr. Jody Boffa there, a research fellow with Stellenbosch University and also UKZN.